Do you know you could have kidney disease and not even know it? 9 out of 10 people who have stage 3 chronic kidney disease do not know it. The rate of kidney failure for African Americans is 3 times higher than among Caucasians. And one reason for this is that they are not aware when they have earlier stages of kidney disease. At a time, treatment could prevent the damage from progressing to the point when dialysis or kidney transplantation is necessary. In addition, due to high rates of diabetes, high blood pressure, and heart disease, Blacks and African Americans have an increased risk of developing kidney failure. African Americans need to be aware of these risk factors and visit their doctor or clinic regularly to check their blood sugar, blood pressure, urine protein, and kidney function. Be aware. Get tested. The life you save may be your own. For more information, contact urbankidneyalliance.org.
Good evening. Welcome to World Kidney News International. I am your host, Steve Belcher. Thank you for joining us. And I'd like to say welcome to our audience watching globally. Thank you for watching. Tonight, we have, again, a special guest who's going to be a regular on World Kidney News International, Louise Law from the United Kingdom, and also a kidney warrior herself, is here tonight. I mean, share this broadcast, guys. It's about 12:10 in the morning, UK time, and Louise was gracious enough to get up out of her bed at 12:10 in the morning to help co-host this show and to give us her experience and knowledge of kidney care in the UK and how it's different than the kidney care in the United States. So without further ado, let's get it popping. Let me give her the VIP intro. Louise Law from the United Kingdom. Hey, Louise, how you doing?
Nice one. I'm all right. You?
Pretty good.
Good.
You look, I mean, to be 12:10 in the morning, you look very bushy-eyed and bright-tailed.
Yeah, I slept this afternoon again today, so that could be here tonight. So I'll be getting back into bed, ready for a busy day tomorrow after this. But yeah, I'm fine.
Right, thank you. So what's going on with you? It's been a week since we last talked, far as on here. How has the lockdown in the United Kingdom, how is that going?
Well, I'm shielding actually because I received a letter from the council and from the government asking me to shield. So, but to be fair, I'm allowed out in the car, and I took my daughter today to the shop, and she came out and she said, "Mum, it's not a lockdown. Everybody's out. They're not listening. They're out and about. Just, I mean, a shop over here we've got was just absolutely packed. People were buying more than just essentials, and we are supposed to be just buying essentials." So I don't know what's going on, Steve. I really don't know
Wow.
what's going on. It's crazy.
Wait a minute. You mentioned something that I don't think they do here. You said you received a letter from the government to shield. Now,
Yeah.
what does that mean, shield? Can you explain to the people watching?
Yeah, I mean, they only advised it the first lockdown. They told us we had to shield, and it was a case of we went out. We weren't allowed out of our homes. We were allowed in the garden, but we weren't allowed out of our homes into society to prevent us from picking up the infection. Because if we pick up the infection, we'd obviously be seriously ill in hospital. With regards to shielding now, it's only advised, and again, we're locked in our houses. We can go out for a walk though. We can go out for as many walks in the fresh air as we like, but we are advised to stay away from as many people as possible and avoid shops. Most shielded people have decided not to do it because of the mental health, is, a lot of people are struggling with that at the moment. But I personally have decided, because getting 2 letters from 2 different departments, I thought, no, I need to really take this advice and stay put as much as I can, really.
Wow. Now,
Yeah.
you said something very, very important. Guys, share this broadcast. Wait a minute, Louise. If you're watching this, share this broadcast. We got to have more than 9 people on this. This is the first edition of World Kidney News International. We got to have more warriors on here. This is international. But I guarantee you the next show, I want to make sure that this gets international in some of the Facebook groups, because, you know, kidney disease is not a UK problem or a United States problem. It's a global problem.
Definitely.
And there's a lot of people dealing with this disease. Now, you said something very important, Louise.
Mm-hmm.
You said a lot of people, because of their mental health, they kind of get out. Now, speaking of mental health, in the UK, there are actually at the clinics psychologists and social workers that are in these clinics. And what I find kind of intriguing about that is I want to say the British Society, I can't remember the name of them. They actually say it's a shortage of psychologists in the units, from the past years. But here in the United States, there's not even one psychologist for a patient to talk to in the dialysis clinic. So share a little bit about, I know you're not a health official, but how long, when you started kidney disease or dialysis, how long has these psychologists been in the renal units or been available to kidney patients in the UK?
Yeah, as far as I'm aware, they were available when I was younger. So that was in 2013, but they weren't as popular then. They weren't kind of on the wards. I mean, they're not on the wards specifically, but there is a renal psychologist that works in the hospital. So as long as I can remember, there's always been some kind of support there. You do have to be referred, and you have to ask for that help if you need that help. But more often than not, I know for myself, the doctors have referred me when they've actually noticed that I've needed that, because we work with the doctors all the time and we see the doctors all the time. They're so used to seeing us, and they know exactly when we need that help. With regards to the psychologists now, we do have renal social workers as well who help us like sort out our money, refer us to citizens advice. They go through forms with us. We have got such a good background of that. I've had psychology for with help with my mental health for about, I'd say about 10 years. I've had that available. You do get sessions of about 13 sessions, but
Wow.
after that you then have to then go back and hope for you okay, and if you're not, you then get re-referred. But the one interesting thing you said is about shortage. I know you don't get any in the USA, but there is a massive shortage of them over here because the mental health and mindfulness is a massive, massive thing on kidney failure. And in fact, I was talking to what we call a renal arts team the other day, and they specified that they're actually trying to get a program set up for kidney patients free for mindfulness, because it is so important that you have that mindfulness there, and then you're able to use a physical, if you've got mindfulness, your physical ability, and you straight away feel okay in yourself if you're positive. Whereas if you don't have that and you feel fed up in your brain, it affects your physical function as well, so therefore affecting your mood, which makes dialysis and kidney failure so much harder to cope with.
Wow. And let me just say this has nothing to do with kidney disease. I better not see nobody come out with no international kidney news broadcast. And I'm telling you, better not nobody come out with no international show.
No,
I just had to put that out there. But look, Louise, it says mental health in the UK, up to 1 in 3 patients with kidney disease will experience depression at some point.
Yeah.
2, none of the 84 units, and I find this amazing, only 84 units in the United States. It's about 8,000 units, but it says none of the 84 units in the UK employs the recommended number of social workers for their kidney patient population, and only 5% employ the recommended number of psychologists for their patient. Then it says in renal pediatric care, over the last 15 years, psychology and social work services has decreased by 21%.
Right, that is quite shocking actually, because I know when I was younger, I was offered the support, but I never wanted it. I only ever needed it when I got to adulthood. But that is quite shocking. But I do know that you do have to wait a long time to get into psychology. But when we think about it, when you're not getting it, we're actually quite lucky that we actually have that support there. However, it is shocking that it is getting worse, really, that situation. 1 in 3, and especially, like I say, with the COVID, even in America with the COVID, it's rife over there, isn't it? It's really bad over there. I don't know if you're doing any kind of shielding, or if vulnerable people are asked to put. Are you doing any shielding or anything like that?
Oh yeah, they're still doing it, and some states is going by. Some states are worse than others, initiating certain lockdown protocols. Just like you're able to go out for essentials, maybe exercise, but no large gatherings, nothing like that. They had opened up stores. Now in some places, they're reducing the capacity load inside the store. If it gets to that capacity, then they only allow one out, one in, one out, one in. We had a quick comment or question from Miss Gloria Mongo. Thank you, Miss Mongo. I love you to death. I appreciate you. She's out in California, but she says this. She says, what if, or does Great Britain celebrate Thanksgiving and Christmas and New Year's? What, if any, are there shelter-in-place protocols like eat outside, limited family indoors? Also, is there essential shortages like toilet paper, hand sanitizer, etc.? Can you comment on that, Louise?
Yeah, the toilet roll and has always been a problem. We've got many jokes over here about the toilet roll and the hand sanitizer. When we first went, it's not so much now, but in the first lockdown back in April, May, the toilet paper, well, even pasta and bread and just your basics like tins of beans, your soups, they all ran out. The shelves were empty. We even had an NHS nurse crying because she couldn't get some food and she needed toilet roll, and she was crying in the car saying, I've just finished a long shift and I can't even get what I want because there's just so many greedy people out there just taking it all off the shelves. I mean,
You're
we
right.
laugh about it now, but at the time it was quite, there were a lot of people that were quite stressed about it. So yeah, it did become quite a joke about the toilet paper because, we were like, why would anybody do that? There's always going to be toilet paper. If everybody buys it, of course there's not going to be any if you bulk buy, but if you leave enough for each person, then there is enough. Anyway, that was crazy. The next thing, with regards to Christmas, it's a big question mark over the UK at the moment with that one. Everybody's hoping we can have a normal Christmas. With regards to sitting outside, if we sat outside, we'd have to have fires burning, wrapped up with scarves, hats, gloves, coats. It's not really possible in England because the weather's really, really cold in December. So it is a case of we want to go inside and eat Christmas meals with our family. It is the only time really, other than Easter, that we celebrate as a family. We don't have Thanksgiving. We only have Christmas and Easter. So it is a very big time. It's Christmas for the UK population, or for most of the UK population. So the big question mark is we don't know if they're going to extend the lockdown or if we're going to come out of that on the 2nd of December. Hopefully, we'll be able to celebrate with our family and come out on the 2nd of December. So we'll see.
Yeah, I'm not going to get into Thanksgiving because I'm sure y'all don't celebrate, but I know why we celebrate. And, if you get into the seriousness of it, a lot of indigenous people got slaughtered around Thanksgiving in the past, but that's neither here nor there. Let me ask you, Mrs. Mongo wanted to know, and we noticed that is CKD medical service free, which it is from the NHS, right?
Yes, that's right. Yeah.
National Health Service.
Yeah, National Health Service. Yeah.
And the transplant is free as well.
It is, yeah. We get transplants for free.
And the medication?
Medication's free. Some people have to pay if you're on. If you're working, you have to pay, but you can get what they call a prepayment prescription. So you just pay per year, and it's a lot cheaper than getting all the drugs individually throughout the year. But the medication straight after transplant for 3 months is free, and then the medication you have to pay for. But it's not anywhere near as expensive as what it is in the US. I mean, I think for a prescription, which includes what your one medication, that's about £9 for prescription. And then you get all your medication on that. So that's not actually that bad. However, everything else is completely free. Your dialysis equipment, transplants, the appointments, the outpatient appointments, everything else like that is free.
Wow. Now, I was looking at your transplant and donation in the UK. And even though, UK is, small in population, I just seen some of the statistics which are different, I guess, because of the numbers. But it says, here we go. In the UK, approximately 3,000 kidney transplants take place every year, but around 5,000 people are still waiting.
Yeah.
I mean, that's a lot. 3,000 transplants each year, 5,000 waiting. In the United States, I don't know how many transplants take place each year, but I do know more than 100,000 people are waiting for a life-saving kidney transplant. Now, what do you think? I saw the expression on your face. 100,000, Louise. What do you think about that? 100,000 people waiting or more waiting for a kidney transplant.
Well, I think it's shocking. I mean, I did a little thing because I'm doing a little thing about organ donation, and I actually looked at the number of deaths in the United Kingdom compared to the amount of transplants that we had, and the difference was vast. You're talking hundreds of thousands. So it'd be interesting to compare that with the amount of deaths you have, because my idea is, if you've got so many deaths in the country, why are they not being donated? Why is there such a massive big gap? Because, you know, when we were born to die, my attitude is we're born to die. We came from nothing, we go to nothing, and we've got to be thankful for we're alive. But once we've passed away, that organ is so important to somebody else to be able to live the life that you've lived. And God, you know, God bless the ones that are taken early. And that's awful and it's devastating. However, you know, with that amount of shortage, people do need to really start donating and maybe having conversations with family. I know here in the UK, death is a very, very taboo subject, and I understand why some people don't like to talk about it, because it is a horrible, horrible situation, but we all know it's going to happen. So just that one conversation with your family member to tell them you want to be able to donate your kidney or any organ to somebody, you know, to somebody to help them, just that one conversation, and you can forget about it. One conversation will change a lot of people's lives. And talking about that, 100,000 waiting, that's huge amount. I mean, I don't know your protocol over there for donation, but we have just gone to an opt-in, an opt-out, where you've got to actually you donate your kidneys or your heart, your liver, unless you decide not to, when you sign a register to say you don't want to. And I think that is probably, hopefully, going to work better. But, you know, maybe something in the US could come in like that. I know there might be something that you're trying to push to do that. I just can't understand it, to be honest. It's quite shocking. And what is the main cause? Diabetes that causes
diabetes and hypertension. And Miss Gloria, that's why I like Miss Gloria, because she even went in to say 9 pounds in England currently is around $11. So you're paying, I mean, that's really cheap for medication.
Yeah, it is. We're very lucky. Some people think it's expensive, but when you actually need the service a lot and you get a lot of medication for that, then we're lucky. But some people do complain about it. I do know if you've got diabetes, though, you do get your prescriptions free. If you got diabetes over here,
wow,
it's free.
Yeah, it ain't nothing, I mean, really free over here. I mean, you could probably, depending on, you know, your income level or, you know, whatever, but it's always something you got to come out of your pocket with. And that's why I don't know. I think United States should take the same lead as United Kingdom. I mean, we're a capitalistic country, and, you know, there's two main corporations that dominate about 70 to 80% of the dialysis industry, and that's DaVita and Fresenius. So I'm not sure if you know the cost in the UK. I know it's free, but if what it costs the NHS to treat kidney disease. But here in 2017, treating Medicare beneficiaries with CKD cost over $84 billion.
Wow.
And treating people with end-stage renal disease costs an additional $36 billion. So this is a moneymaker over here.
Yeah.
We got 37 million US adults are estimated to have CKD, and most are undiagnosed.
Yeah.
Okay.
Yeah.
I
mean, you said something about Fresenius there, because we actually use Fresenius over here. It's one of the machines that we have for the dialysis. And I think, if my rights are correctly, some units use Fresenius for the actual dialysis equipment. I know we did used to use Baxter. I think some places do, but I think, as far as I'm aware, Leeds changed to Fresenius. So if you think about the cost that it costs yourselves, we get that Fresenius for nothing. I mean, like I said before, we do pay our national insurance, but that isn't, each person in the country pays a little bit out of the wage towards national insurance, which helps pay towards the NHS. So we're all paying for that as a country, as a united kind of community, and the government obviously fork out a lot of money from the taxpayers' money, from the tax and the national insurance, and that's how it gets spent. So
Right.
I think America should really try and get that. I mean, there must be something. If they're them companies you've mentioned are earning millions of pounds, why not put it back to society and let there be an NHS? They don't need all that money. That one person doesn't need all that money, because eventually, obviously, there's somebody at the top getting a hell of a lot of pay.
Oh, yeah. The people at the dialysis corporations, the CEOs are getting like $24-25 million a year.
But what makes me angry about that is if it was them that needed the treatment and they couldn't afford it, if they weren't in the position they are, they'd never think about the positions that they could be in if they weren't in that position they are. They don't think about the poorer side of society or the people that can't earn 24 million and have to fork out the money for the transplants and everything else. And I know you have the insurance, but you want to get 80% of that. They've got to fork out the other 20%. Now, for me, I know I wouldn't be able to afford that if I was to need that. I'd have to stay on dialysis and save up, but it'd take me a lifetime to save up, which would mean I'd be on dialysis for a lifetime. And that is just drastic, to be on dialysis for so long,
Right. Now, and here goes some other startling information you probably didn't know about kidney disease in the United States. And where I'm getting this information from is cdc.gov about kidney disease. I just want to show people. I don't want them to think I'm, coming out of nowhere. But it says that every 24 hours, about 340 people begin dialysis treatment for kidney failure. Wow. Every 24 hours, 340. Do y'all have that many diagnoses in the United Kingdom?
Not that I'm aware of. I mean, I can Google it, or if you've got it there, you can Google it for me, because I'm using my phone to.
Sure, don't worry about it. But I mean, does that seem like a high amount of people starting going in the dialysis for renal failure every 24 hours, 340 people?
Yeah, it's shocking. Absolutely shocking. I mean, my question to that is, my answer to that is why. I know that it's a hidden disease, and sometimes there's not any, you don't notice it, but maybe you need regular testing of urine. That's the first sign of kidney disease, when your urine's like
protein,
protein and your urea's high. Maybe there should be something where you get checked every so often. I know that when the way I got kidney failure, I had it since I was born, but they never found out till I was 13. Yeah, I was a doctor's with migraines, which is another massive signifier of disease, high blood pressure and migraines. Not once did they check my blood pressure or my urine. And times have changed now over here in the UK. They do check your blood pressure and they do check your urine whenever you go into hospital. I don't know what it's like in the USA. But, in my eyes, that the fact that there's so many, it needs digging deeper as to why that's not being picked up. Because if you could pick something up, then maybe it can be saved, and you don't have to get to the point where you're on dialysis.
Absolutely.
I mean,
and that's what we try to promote here as well, awareness and education. And it's not enough being promoted here. What about in the UK? How is awareness and prevention handled in the United Kingdom?
Well, you get the odd advert about organ donation, but with regards to dialysis, absolutely nothing. I did a performance, just 10 minutes, just to see if taking my performance to stage about organ donation would be worth doing. And I did it to a group of 16, 17 and 18-year-olds. And not one of them knew what your kidneys did. Not one of them knew that your kidneys could fail. You know, not one of them knew that you could have multiple transplants if one didn't work. They thought that was a cure. It's just, I was absolutely shocked, and it made me think, I do need to do this. We do need to get this on stage, on telly, everywhere we possibly can, because nobody is aware of it. And we're going wrong by not teaching our children it. It should be taught in biology at school, in sciences, because so many other things are, but none of the others are. You know, it's not taught enough in the UK.
Yeah, I mean, it's the same over here as well. Yeah. It's not taught enough, and in fact, that's why we're doing these shows, because there's no education like it should be, and you have a lot of organizations that talk about it, but they don't really get into the communities to really educate. Now, we have one organization I think is great, patient organization called AAKP, American Association for Kidney Patients. They're doing phenomenal work in trying to reach all spectrums of people with kidney disease. They're trying to hit the urban communities, overseas, regular communities. They're not trying to leave no stone unturned. What I wanted to ask you, like here in the United States, it says diabetes and high blood pressure are the leading cause of kidney failure, representing about 3 out of 4 new cases. Is that the same in UK? Are the common causes is diabetes and hypertension?
Diabetes, yeah. Diabetes is one of the leading causes in the UK. It's one of the leading causes. Obviously, there's many other causes, but diabetes is a problem, especially in the elderly as well. You know, we do have a lot of elderly population on dialysis. I mean, there's obviously polycystic kidney disease. That's a big one as well. But yeah, diabetes is a massive problem here in the UK for that. And again, that's going down to people's diets and things like that. You know, if your mindfulness is down, your diet becomes low, so therefore you're more likely to pick up diabetes. So it all goes back to your mindfulness and things like that. So yeah, it is more or less the same in the UK about the diabetes. And again, that should be picked up sooner, because sometimes there aren't many warning signs for diabetes. You know, they are. So, I mean, I'm not a diabetic myself, so I can't really discuss it. But I do know that sometimes you can be diabetic and not know it until it's
absolutely.
Yeah. But
it's really big here in the United States.
Yeah. I mean, I think it'd be bigger over in the United States, not one because of the population, but sometimes like a lot of the burgers and things like that. I know that there's a lot more sugar. We're trying to tax sugar now in the UK. We have a sugar tax, so anything with sugar in it is taxed.
Wow, that's almost about anything.
Yeah. So that therefore, like, you know, a lot of people avoid it. You can get Diet Coke for much cheaper, and in fact, the soda society has gone up so much. You know, the soda cost, has gone up because of the sugar. So yeah, it's we are finding ways to bring that down, but not enough.
Now, let me ask you: do kidney disease, does it fall in the top 10 causes of death in the UK?
It doesn't. No, I was looking the other day, and it doesn't. But what does is, and what strikes me as alarming, is a lot of our kidney patients actually die of heart attacks. They die of other causes rather than the kidney failure, and that is the heart attacks and heart disease is the highest in the UK. So a large percentage of that will be the first problem would be kidney failure. But here they put you kind of death status as what you have when you pass away. They wouldn't put heart attack, but due to kidney failure, it would just go down as heart attack. So I did think, well, maybe the figures aren't maybe correct. I know there obviously will be, but it just made me think, well, a lot of them kidney patients do have heart attacks. But there's 1 in 5 people can get kidney failure over in the UK. I got that from the Kidney Care UK.
Right.
And yeah, I think I worked out about 33% of people can get it, but it's not the biggest killer. Your biggest killers are your heart attack and your cancers.
Yeah. Now, here in the United States, kidney disease is the 9th leading cause of death.
Wow.
You know, and just like UK, there's no signs or symptoms. Now let me ask you, how often before one starts dialysis in the UK are they able to see a dietitian?
Well, you can see a dietitian whenever. I see one now sometimes, even though I'm transplanted. You see a dietitian straight after dialysis. It's one of the things that happen straight after transplantation. With regards to dialysis, you kind of in the diabetic team are kind of the dietitian team are in touch with you quite often. And you know, you'll pop to clinic and they'll just say, "Oh, can I see you?" They're very, very accessible here, and you can just, like I say, I could just walk down the corridor in the hospital, and if I see a dietitian free and available, I can just knock on the door and ask for advice. Now, that is in obviously my unit. I'm not sure what it's like elsewhere, but with regards to the Leeds Trust, they're very, very accessible and they're very, very good. You know, I was having trouble with my weight a few months, about 6 months ago, because of lockdown, and they really helped me. You know, they were telling me what portion sizes to have, when to have them, and that was just me attending a normal clinic, and I saw one available. So yeah, I don't know what's it like in the USA. Is it like that in the USA or?
In the United States, you know, when people go to dialysis, there's a dietitian in the clinic.
Yeah.
And so when someone goes in to do treatment, what the dietitian does, like if you request to see the dietitian, they will come, but most of the time they'll come by your chair to go over your lab work once they get the monthly labs back, and you know, go over the results and say what you can do to rectify this or rectify that, or if you're doing good or whatever the case. After transplant, what I've known from someone that I've talked with that had a transplant, they just gave her a package with the information in. So it's like there's no structure to say, okay, after you get your transplant, you need to see the dietitian. That's something that you may have to do on your own, and then find that person who may do renal dietary or have that experience, you know, treating patient with kidney disease.
Yeah.
So it's not, again, and that's not free. I mean, you would have to pay for that dietary service, you know, unless insurance may cover it. And if insurance don't cover it, it comes out of your pocket.
No, I mean, the diet in a dialysis patient and a kidney patient is so important, because obviously you're aware, and many people that are watching who have kidney disease will be aware that you know, everything in food, you've got your potassium, you've got phosphates, you know, you've got everything, a lot of things that shouldn't be in there, from not being able to eat grapes, not being able to eat minced beef, not being able to eat, there's a whole lot of list that you can't eat. To not have a dietitian, if you can't afford one, to not be able to get one, how are you supposed to educate yourself on what to eat and live a better life and make your kidney function remain stable on or your dialysis levels remain stable? If your potassium level goes high because you've not had that dietary kind of advice, then that's down to them, not you, but then you will be labelled as not looking after yourself. But really, they should be given that advice, because if not, you're not going to be the healthiest you can be. And I know myself, when I was on dialysis, if I ate something that, and even now with my kidney, if I have a coffee extra, and I can feel it, I can feel that I've had too much potassium. So being on dialysis and having something that you can't have because you don't know you can't have it, you will feel it, but then that dietitian should be able to tell you that. A leaflet's no good. Sometimes you lose them. You know, I mean, we do get leaflets when after transplantation. We do get leaflets, but it's explained to us before we leave the hospital, and we have to take kind of a little question and answer session before we leave to make sure we know what we can eat, what tablets we take, things like that. And again, it all boils down to money.
Yeah.
You know, you'll be safe. The monopolist capitalism you have there will be wanting to save money, because the less they can give for the money you have to pay, the better,
Right.
isn't it? Do you know what I mean? Whereas
Yeah.
over here, it just kind of comes part of the package, and the nurses discuss things as well with us about it. It is always available. It's just it just amazes me that it's so unkind that they're not giving you that kind of service.
Yeah, again, it's all about the money. It really is, and it's unfortunate. Now, we know it's not all patients with kidney disease progress to kidney failure. And to help prevent CKD and lower the risk for kidney failure, control risk factors for CKD, get tested yearly, make lifestyle changes, take medicine as needed, and see your healthcare team regularly. I mean, so I say that to say, even if someone has stage 2, stage 3 kidney disease, that doesn't necessarily mean it's going to progress to kidney failure, especially if you, like you say, as you talk about it, being mindfulness and changing your health behavior and your lifestyle. But that's kind of hard, because if you got 9 out of 10 people that have stage 3 and don't even know it, that's going to kind of be hard if they don't know it and they keep doing the same behavior that got them to stage 3. They're more than likely to hit stage 5 sooner than later.
Yeah.
With that being said, and I know obviously over the UK there's not enough awareness, but how do most people find out if they have stage 3 or kidney disease? Through like a routine blood test? If they go for something else?
I'm not really sure, to be honest. So I've not really looked at that data. But I do know myself it was a shock. It was too late. My kidneys had failed. With polycystic kidneys, I do know that obviously that they know about that. That takes time, and that's through testing as a child and getting urine infections. And because we now test urine infections here in the UK, it is picked up pretty early. But sometimes it depends on the disease, like polycystic kidney disease, when you know that eventually, hopefully it won't happen, but normally, eventually it does get so bad that you need to be transplanted. With reflux, with myself, reflux, that is picked up through urine tests. Mine wasn't picked up, but I know it is now. And I know that if it's, sometimes it can be fixed before you actually have the problem. If I would say that probably, I can't quote me on this, but that, a lot of people, if they don't have routine blood tests, will not know. They will end up in A&E, and I do know, I read somewhere that a lot of the time your kidneys will fail through going to A&E when you're actually in an A&E position, because you go to A&E, you're really, really poorly, they're gone to A&E, they get picked up, they have the blood test, it's picked up. So I did read that the more people do get diagnosed when they go to an A&E incident, for instance. Other than that, I don't really know how they pick it up, because it's
Right.
again, it's not openly advertised. So my lack of knowledge there, I would have to go and look for that information shouldn't have to look for that information. You should be able to know how you can get tested and how you can find out. So that again is a lack of education for me and for other people in society as well. And I've dealt with kidney failure since I was, well, for 28 years now. And I don't
Wow.
know. So it is obviously the fact that somebody that's so used to kidney failure doesn't know, that just creates obviously the massive awareness that we need to push it. We need to push how to find out if you've got it.
Mm-hmm. One thing I just want to touch on, Miss Bridget. Thank you for watching, Miss Bridget. I appreciate you tuning in on the last show as well. Thank you so much. She said a lot recover from the virus, the corona, and end up on dialysis or need a transplant. Now, that is true because I just talked with a nurse last week at outside of a DaVita unit and where I live at in Washington, D.C., and she told me that they're starting to get a lot of post-COVID patients that have kidney disease that affect their kidneys. And what the doctors are doing is when that happens, when they leave the hospital, they had a catheter and they do dialysis. And once a person is on, or they remove the catheter and they try to put a access in the arm. But here, after 3 months, like a person can be acute dialysis.
Yeah.
And after 3 months, they're considered chronic. Even if they're still in acute phase, they're noted as chronic. And even if they do move on to chronic, that's just adding more people to the list. Right now, we're dealing with more than 100,000 people on the transplant waiting list.
Yeah.
More than 100,000. And I know UK is like maybe 30,000.
Yeah. Yeah.
And that's like a 70,000 people difference.
Yeah. Yeah. I mean, I guess the sizes of the countries are different, but that is still a hell of a lot of people to be waiting in both countries. I don't understand why there should be anybody waiting in either country at this day and age. I mean, yeah, we know that not everybody can give transplants. We know that, you know, not everybody can give a transplant away. The organs aren't able to be put into somebody else for various reasons. However, the massive difference between the amount of deaths and the amount of transplants that go ahead, that everybody should be able to get a transplant. And here in the UK, I'm talking, I don't know about the USA deaths, but I've been doing a study on it, and everybody should be able to get a transplant, but we don't. And there's too much of and not all them kidneys that are not being donated cannot possibly have something wrong with them. So again, it does go down to lack of knowledge. And I can't stress enough the importance of that, you know, the importance of doing that. And the fact that COVID is affecting it. A lot of the time, I've been on medications before that have actually ruined my kidney. After I had my fourth transplant, I got CMV. I don't know if you've heard of it. I can't say the proper word for it, but I got that. CMV for short. And it was attacking all of my organs. So I was given something called foscarnate. Now, my kidney function was at 50% after transplant, and this is only 5 weeks after transplant that I got the CMV. And it went right down to 12%. And that was because of the foscarnate. It's an unknown, it's a medication, I think it was still on trial at the time, and they knew that it would affect my kidney function, but I had to get rid of the CMV because it was either lose all my organs or just potentially lose the newly transplanted kidney. So maybe it's something in the COVID, something that they're treating it with that's causing it, because a lot of medications do cause kidney failure. I know a gentleman who just took a regular antibiotic and he suddenly got kidney failure. I think it was penicillin, and it killed his kidneys off. It had penicillin all his life, and then suddenly this one time he took it and it killed him off. So, and
Wow.
obviously, overuse of paracetamol, that can cause, even that can cause kidney failure. So maybe it's something with regards to COVID, maybe it's something like that that's actually causing, there is a drug that they're using that's causing it.
So Ms. Mongo had a question. She wants to know, did you know who your donor was?
No, for all four, I didn't know my donors. We get told their age and the gender, and that is it.
Okay. Do they tell you if it's a healthy kidney, or is it from a young adult or a child or anything like that?
No, they do tell you the age. So for instance, my first one I got was from a 22-year-old, and it came from France. It didn't match anybody in France, but it matched me, so it came to me. My second one was from a 52-year-old gentleman. My second one from a 62-year-old lady, and my fourth one was from a 58-year-old gentleman.
Wow.
So you know their ages, and they do tell you, sometimes they tell you that how they've passed. Because one of mine was where they have to turn the life support off, but the kidneys, the organs are still working for a short while, so they rush them to theatre and then take them out. So I do know that one of them was that, but all of them have been cadaveric, so none of them been live donors. Unfortunately, I've not got anybody that is suitable to be able to do it, because I've got a really kind of, because I've had a few different transplants. One of them wasn't so very good. Over here we have 5 levels, so you've got A, B, C, and D. Sorry, 4. A, B, C, D. D is your worst kind of transplant, the one that doesn't match as much. So not worst, because at least it's time off dialysis, but it's the one that doesn't match as much, right through to A, which is a perfect match. My first one was an A, and then my second one was a D, so it was like not very good. So then obviously I built up antibodies because I've had loads of transplants. So my mum's actually a match, but because I've got an antibody in me that would fight her kidney, she couldn't give me it. But she's like a match, but it would kill off that kidney. But that was kind of about, I think it was about 6 years ago now. And now they use plasma exchange to get rid of the antibodies. I don't know what they do in the UK, in the USA. But here they use plasma exchange to get rid of that antibody. Whereas back then they didn't. It was on trial, and my mum didn't want to risk it. Neither of us wanted to risk it at the time, because I thought if I had her kidney and it was to fail because of this antibody, I'd never forgive myself.
Right.
So yeah, they've all been. We don't get to know anything else. You can write to them. You can send a letter to our donors. I've never had a response, but I know some people do have responses.
Sure. Wow. Man, this has been very, very informative, Louise. Wow. As we kind of end the show, what would you want to say to people watching here in the United States and United Kingdom about kidney disease and being a 4-time transplant recipient?
Well, first of all, thanks everybody for kind of watching, especially in the UK, because I know that it's 1:00 in the morning now. And thank you everybody in the USA. It's nice to see you all, even though I can't see you. It's very weird, this virtual world. But thanks for your comments as well. That's been wonderful to have some questions this evening. And I just hope that more people join us so that we can make more awareness of this internationally as well as nationally. With regards to the 4 transplants, it's been touch and go a few times. I've had a lot of years on and off dialysis. Some doctors joke that I could do their job. But yeah, you've just got to keep fighting through. It's tough, and dialysis is tough. And we'd never want to be in that situation. But thank God we're alive. And, you know, if we can get through this, we're strong. And it's one of the most chronic diseases you could have. And unfortunately, we're the ones that have got it. But if we just keep positive, keep fighting through, keep that mental mind, your mindfulness strong, eat healthy, and you know, you will get through it. And
Mm-hmm.
hopefully me and Steve doing this will enable us to kind of get an awareness and hopefully get more transplants done both over the next couple of years.
Absolutely, absolutely. So one thing I wanted to ask you, Miss Gloria had a question, but do y'all have something called the shared paired exchange or paired exchange?
Yes, we
When
do.
y'all have that?
Yeah, we do. Yeah.
Okay. And then this question right here. Do
Yeah.
you know if your donor, like if you had a living donor instead of a deceased donor,
Yeah.
would that donor go on a priority? Is there a priority list if that donor needed a kidney transplant themselves?
No.
So for instance, if let's say you had a friend and she came and said, Louise, I want to donate a kidney to you. She donated and the kidney worked well. And then say 5 years, 6 years later, your friend got kidney failure. She would have to go through the same process of waiting like you. There's no list to say, since you donated your organ, we're going to put you at the top. So if you get kidney failure, we're able to give you the first kidney available.
Not that I'm aware of. I wouldn't imagine so. They might get. We work on a points system over here, and I know that children get a lot more points because obviously they need it. You know, it's only fair they get it a bit sooner. But it does work on a point system. So, but not that I'm aware of. But it'd be interesting to find that out because I've never really thought about that, because you just expect that they would take a healthy kidney from a healthy person and nothing would happen. But like, we don't know what's going to happen, do we? We don't know what's going to happen.
Oh no, not at all.
So yeah, it'd be interesting for us to look up that because not that I know of.
Yeah, look that up because here, and then I'll end the show. I met a gentleman that donated a kidney to his mother, right?
Yeah.
That kidney lasted 5 years. And then he ended up on dialysis.
Wow.
And he didn't want any of his kids to donate because of the experience he went through with donating to his mom. That kidney, like I said, the kidney he donated to his mom lasted 5 years. And I'm not sure what happened to her. And with him, he ended up on dialysis some years later after the donation. So, I mean, you're right. You never know what can happen when a donor donates. I mean, anything can happen. You could take some medicine that could knock out that one kidney. You got a lot of nephrotoxic medication that can do damage. Somebody could go in for an MRI and not really think about the dye contrast they use and drink that can knock out the kidney. I mean, so many things, environmental things that could damage the kidney that you just got to be careful. It's like now it's more than just diabetes or hypertension, even though those are two leading causes, but there are other things to look at as well that can knock out your kidneys besides diabetes or hypertension. Even medication like taking pain medicine like Advil or ibuprofen over years can damage your kidneys.
Yeah, definitely. I mean, there's a comment there, but I was going to mention, but I've forgotten now. That thing. I think that's why I didn't take my mum's, because as much as I would have loved to, I know that if it had failed, I would have been absolutely devastated. My mum would have been upset that she'd given it to me, and then obviously she might be at risk at catching something. So I would have never lived it, but felt so guilty. With regards to the failing, I know somebody, God bless him, is passed now. It was my age, a year younger. He passed away, and he had 3 transplants. And his second one was from his dad, and it failed the day after he had it, and it was from his dad. So can you imagine that feeling of guilt?
Yeah.
I think live donation, MG's live donation is an absolute amazing. And I don't personally know one, but I have spoken to somebody who gave a kidney to a stranger who just walked into the hospital and wanted to give a kidney away. But I don't personally know him, but I have spoken to him. And I just find it amazing, but he says he don't want praise because he did it to help somebody. But I think it's absolutely amazing, and but it's got to be really tough protocols, you know. And I know that it is tough here in the UK. They do have to go through a lot of tests and psychology and things like that over here. So
wow,
to make sure that it's right for them and for the other person, you know.
Right.
Yeah, a few stories there for you.
Yeah, that's crazy. Here in the U.S., they go on top of a priority list in the United States if they give a transplant. So, wow, this has been a awesome show, Louise. I really appreciate you coming on, and I can't wait to wait for next week.
Let's hope it's more viewers next week. We'll have to share it and get everybody on and share it, because it is. I'm thinking, getting to know new stuff, you know. And I know you've been a nurse before and things, but I'm a patient and I'm getting to know new stuff. So it's quite interesting, really. Oh,
absolutely. Yeah. So I look forward to seeing you next week. And if you have, any topics that you want to discuss, please, reach out to me through Messenger, and we'll do that for next week.
That's perfect. Thank you, Steve.
Thank you, Louise, for staying up late. I know
thank you to everybody.
It's like 1:00 there, 1:05. So get some sleep.
Yeah, I will do. And have a lovely evening. Bye to everybody over in the USA. Have a lovely evening.
You too, Louise. Thank you. God bless you, and take care.
Thank you. Bye-bye.
All right.
You too. Bye.
Bye-bye.
Bye.
All right. So, guys, this has been a wonderful show. Thank you for watching the first broadcast of World Kidney News International. It's just like CNN International. We're doing World Kidney News International. With that being said, I'd like to thank everyone who joined this broadcast. Mr. Vincent, thank you. Thank you so much. Please like, follow, and share our pages: Urban Health Outreach Media, Urban Kidney Alliance. I'm a nurse. I know this is my first time seeing you, so I just want you to know you're not getting education from someone in the field. I've been a renal nurse for about 33 years, medically retired, and so now I'm giving back because I work for the profiteers, DaVita, and I didn't know any better. So this is my way of giving back. Thank you, Kevin, for watching. I appreciate you. Miss Gloria. No, this is not the last show, by no means. Thank you again, Miss Gloria. Miss Bridget, thank you for watching both shows. Vincent, look forward to having you back watching again. Go to Urban Health. Matter of fact, let me just put the banner up before I go so you know where to go. Is this one right here. We're on Facebook and YouTube. And yeah, thank you, man. We just need your support. We need everyone's support to just make this kidney disease aware across the world of what's going on. So with that being said, thank you guys for watching. Thank you, Vince. I appreciate you. Send me a friend request too, man. And guys, thank you. I'd like to thank our new watcher, Vincent Goddard. God bless you, man. Thank you for watching. Miss Gloria, thank you. Don't be stingy. Yeah, thank you, guys. We love you. And I'll see you possibly tomorrow for Mental Health and Me at 7:00. All right. That may still be on the back burner. I'm still deciding if I want to do that show, trying to get a little bit of rest and relaxation. But with that being said, thank you guys for watching. God bless, and we see you soon. Peace.
someday.